Earlier in the hour, we told you about a study by a West Michigan doctor that's being published in the Journal of the American Medical Association. It says 1 in 4 women who undergo a partial mastectomy for breast cancer end up needing follow-up surgeries. Dr. Larry McCahill is the doctor behind that study. He is a surgical oncologist with St. Mary's Healthcare, and he joins us right here in studio. Thank you for joining us.
Thanks for having me.
This is an interesting study. Tell us a little bit about it now. How long did it take to go through this study?
So this represents 6 years of patient operations that were done at 4 hospitals around the country. And what we looked at is, in total, there were 4,500 patients in the study, but we focused on the 2,200 who had a lumpectomy as their first operation. And what we really wanted to see is there a consistency in healthcare when, in terms of the decision making for why surgeons elect to why patients undergo a second operation.
And it doesn't look like there really is consistency there, is there, based on your findings?
Not really. What we do know is that when women have tumor right at the edge of the specimen that was removed, in that situation, 85% of surgeons did a second operation to get greater clearance of tumor. But when it was small margins, just less than a millimeter, it was almost an exact 50-50 split. Half the women had a second operation and half did not. But among the individual surgeons, the re-excision rate varied from 0% to 70%. So that was a range that we totally did not anticipate. It was very broad.
Yeah. So it's a little unsettling, I guess, a woman that has to get a lumpectomy and then sort of has to put her total trust in how far the doctor goes with that.
Right.
What do you do with these findings now?
Well, I think this is going to open a little bit more of a national dialogue in terms of, can we as a healthcare profession really come to a good consensus in terms of what are the clear criteria for which a second operation would be indicated. Unfortunately, we're not there. I mean, the whole purpose of doing the second operation is trying to prevent a local recurrence in the breast. And unfortunately, those recurrences really don't show up to 6, 7, even 8 years later. So it's hard to come to a conclusion without that level of evidence. But that's hoping that our work at St. Mary's and the Van Andel Research Institute, we're hoping to try and study that in the next few years.
So what would your advice be, based on the findings over the last 6 years, things that you've compiled and looked at and studied, what would you tell a woman that is facing a mastectomy? Or a partial mastectomy?
Well, I would tell her to be sure to have a very open dialogue with her surgeon from the very beginning in terms of what criteria will we use to decide on a second operation. And then after a partial mastectomy or lumpectomy is performed for the first time, make sure you sit down with your surgeon and go over the pathology report and make sure that you have a good understanding of what the pathology indicates, the report, and make sure that both you and your surgeon are comfortable with the next steps.
So be proactive with this information and talk to your doctor.
Involved patients get the best care.
Yeah. Larry McCahill, thank you so much for joining us.
Thank you.
Congratulations on your study and having that published.